Hi everyone, I am Vivian. I'm from Changi General Hospital, Singapore. And it's my pleasure to share with you my poster entitled Targeted Geriatric Assessment in the Emergency Room. About 21 to 40% of the ED users are the older people. And they also are the ones who are using more ED services than any other age group. And so, a geriatric ambulatory care service was put up in collaboration with the emergency department to achieve earlier identification and interventions for frail patients with geriatric syndrome. So we did a retrospective review from January 2022 to December 2022 in older patients who are discharged from the ED ambulatory area following the targeted geriatric assessment and the recommended follow-up interventions at the geriatric day clinic or day hospital. So you have two groups identified, one who are compliant to the interventions and the ones who are defaulted. Demographic information, functional ability, hospital utilization, and mortality up to 1 year, and any post-visit fragility fractures were reviewed. The data collection included identification of patients with osteoporosis or osteopenia and cognitive decline during and following the visit, and the findings were compared between the two groups. All statistical analyses were performed using two-tailed tests with a significance level of p-value of 0 less than 0.05. A total of 137 patients were reviewed. 79 patients, or 58%, were compliant to geriatric follow-up, and 58 patients, or 42%, were non-compliant. The age and the sex were similar between the two groups. Most frailty scores are around 4, 5, and 6. The IADLs and the BADLs are similar, almost similar between the two groups. There are more patients were identified as having osteoporosis or high-risk osteopenia in the compliant group, and a large number of patients have unevaluated bone health in the non-compliant group. However, for the fragility fractures were similar between the two groups. Cognition was also assessed, so we have identified cognitive impairment was identified. Patients with dementia was about almost 28% in the compliant group compared to 10% in the non-compliant group. Mild cognitive impairment was also identified in the compliant group of 15%. And a large number of patients have suspected but not evaluated for cognition, about 12% in the non-compliant group. The 7-day reattendance were similar between the two groups, but the 30-day hospital admissions were lower in the compliant group, although at 1-year ED attendances were higher in the compliant group. These did not translate to more than 1 year of hospital admission. Mortality rate was similar between the two groups. So, the targeted geriatric assessment have shown earlier and improved identification of underlying frailty and geriatric syndromes. And before I close, I'd like to thank my colleagues from the Department of Emergency Department, Changi General Hospital, as well as a geriatric department, and our geriatric nurses for making this project possible. Thank you very much.